Hello buddy, San here, engineer, MBA, and investor. And in today's video, I want to have an open discussion on CRISPR Therapeutics and Vertex for CTX001 or Hexacell. Basically the fundamentals and everything about the idea of having it FDA approved. Just wanted to have an open type of discussion where I sort of freely speak out of my mind there without any sort of an agenda there. And I thought it was important here on a Sunday, beautiful Sunday here in Toronto, by the way, very, very sunny. Hopefully wherever you're having some good sun, especially since we're entering the fall, right? Hopefully we'll have some good remaining sunshine before we enter winter, right? So anyways, going back to what I want to talk about here. So obviously we covered 2 days ago, CRISPR Therapeutics and Vertex submitted their FDA submissions. This is something we've expected for months, if not for almost a year. Like I mentioned in that video 2 days ago, I highly recommend you guys to watch it because we went over the press release and the importance of that press release. And of course, now the ball is in the FDA's court. You know, the FDA being regulatory agency in US. I mean, most nations around the world, if not all, really look up to the FDA. And like I mentioned in the past, the FDA there is to serve American citizens. Of course, it's taxpayers' money. So there, I understand both sides why it would take a long time. But at the same time, you have patients with sickle cell disease or beta thalassemia that would greatly benefit from a program like CTX001, a one-time treatment, at most a two-time treatment. Regardless of whether it's ex vivo, in vivo, CRISPR-Cas9, CRISPR-Cas12, base editors, doesn't matter, right? The point here is that we have no CRISPR-based therapy, and this is the first one. And I taught myself how important this program is, right? And I remember when I started making these videos, I would say, yeah, like early part of 2021, if I remember. CRISPR Therapeutics was the first company I analyzed. I mean, I went over their pipeline. If you guys go all the way in my video catalog, you guys will remember exactly me going through this program's pipeline, and it has evolved since then, right? The clinical for certain programs, I mean, they added more programs like the ViaCyte one, and also the in vivo approaches for heart diseases that they want to plan to tackle. So the portfolio expanded, right? But ultimately, it still boils down to this one program: Hexacell beta thalassemia and Hexacell sickle cell disease, with partnership collaboration with Vertex. And of course, Vertex owns 60% of the program, profits, and so on, while CRISPR Therapeutics owns 40% of it, right? So obviously, Vertex has a lot more to lose. I mean, they already poured billions into this program. So you can bet that Vertex leadership will be on all over this, and they are all over this. I mean, we took a look at Vertex a few days ago, an article on Vertex, and their CEO, Reshma, has been all over this program. She's talked highly about CRISPR. She's talked highly about this program. And of course, they have other partnerships in the CRISPR landscape, right? So Vertex is definitely a great partner to have. In my opinion, Vertex is the biggest pharma company in terms of market size in the next few years. I think they'll take that position over Pfizer, over Moderna, any of these companies. I think Pfizer, Moderna, they got really lucky with the pandemic, but I think Vertex moving forward there as we enter this new age of genome editing, this genomics revolution, I think they're leading that space. I think they're leading it very well. And of course, CTX001 will be the first domino to fall with that regards, right? So of course, this product here, there's a lot of importance. Lots of eyes are on this program. I mean, you look at other CRISPR companies like, Beam Therapeutics, Caribou, Verve Therapeutics. I mean, they're all doing different things there that are very important. Everybody has like their own technology or specific disease, NTLA, trying to tackle it with in vivo, and they're doing amazing. NTLA, in my opinion, are doing absolutely everything required to be up there as a top CRISPR company. And of course, Beam Therapeutics with their base editors, and Verve Therapeutics dosing their first patient a few weeks ago, back in early July, by using base editors technology from Beam Therapeutics. So win-win for both of those companies there. Of course, you have Caribou there doing a really good job with the CAR T cell. Although I would love to see more data from CBO10. I think the latest data release was a little bit below, well, it was a little bit average. It started at really, really above average, then it sort of fell down to average, and then a lot of people attention got into Sana biotechnology, which obviously they're not using CRISPR technology, but they're they're doing something really well in the CAR T space. So I'd love to see more from Caribou there. And of course, you have other players like Editas, Graphite Bio, and so on. So my point here of really, talking about this is a lot of eyes are on this program. You may be reading research papers, you may be really, vested into the idea that base setter is the future, or even Prime Medicine. They're filing for IPO sometime soon. We'll be getting valuation very shortly. People's estimated about 100 to 200 million in the IPO. That gives them a value of about 600 to 800 million market cap. But again, there's a lot of question marks surrounding that IPO, and you may be really invested into some of these companies that we just talked about. But I think ultimately we all have this common vision, this common goal where we have CRISPR out there as a therapy, as an alternative for doctors to prescribe to their patients, or hospitals to prescribe to patients that have no alternative cure treatment for certain diseases. In this case, we're talking sickle cell disease or beta thalassemia, but there are many other diseases, right? And that's exactly why the FDA has given designation for a program like CRISPR Therapeutics, that 130 that we took a look at in yesterday's video. So I think it's very, very clear where we stand today. I think all eyes are on this program, CTX001, Hexacell from Vertex and CRISPR Therapeutics. And I think what's going to happen, my Sunday prediction is that Q1 2023, we get this FDA approved. And by June, I would say June, July, we start getting things out in production, start commercializing this product. And I think NTLA submits FDA submissions by end of 2023. I honestly think this is going to happen for NTLA 2001. Of course, I'm talking about their first successful program with in vivo. I'm not talking about NTLA 2002. I'm talking about NTLA 2001, which we've gotten data for over a year and a half almost at this point. So I think what's going to happen is by the end of this year, end of 2023, NTLA will be submitting for FDA submission for 2001, which of course is a partnership with Regeneron, which is also another big pharma company there, successful there. So I think that's what's going to happen. But again, it all falls back to this program, right? If FDA delays it, if FDA for whatever reason puts on hold on it, if FDA denies the application, then this is when I think we'll have a huge setback. I think for Americans watching this video, the couple of things you could do on your end is to write to your local rep about Cures 2.0 Act. I think we need less delays, we need less costs for these companies, less barriers of entries. I totally agree that the FDA should always put regulatory policies to protect citizens. You don't want any program to get out there and harm people because this will set back CRISPR for a long time. And when I say a long time, I'm not talking about 2-3 years. I'm talking a lot longer than this. But ultimately, I think if it has to take 8 to 12 years to get an FDA-approved drug, I think that's completely unacceptable. With the tools we have today, like I mentioned in yesterday's video, the tools we have today, the technology we have today, the forms of communication we have today, it's completely unacceptable to put 30 days on hold like we saw with Beam 201 and have no sort of response until the 30th day where we have an email that goes through Beam 201, Beam leadership saying, they had now a few weeks, few months to give them back a response, and who knows how long this back and forth will go. And that's just for IND submissions, right? We're not even talking about phase 1, or we're not even talking about any sort of data that came out that put the thing in a hold. So completely unacceptable. But that's why I'm saying this program has so much importance. I truly believe that you as an investor, regardless of which company you're supporting or companies or technology you're vested in, this is where everything boils down to. It all boils down to how the FDA approaches to CRISPR Therapeutics and Vertex program CTX001. All of this boils down to this. And I think what's going to happen after that is once it gets FDA approved, the next milestone will be how do they scale this business, right? How do they scale and commercialize this business? Because then based on those experiences, NTLA will learn from this. Beam Therapeutics will learn from this. Verve will learn from this. We know how important it is for production and manufacturing. So there's a reason why Beam invested so much into it. Caribou, they just leased the new office early this year, a new commercial estate there. And I think I was watching, I think it was yesterday's podcast, the All In podcast, and Friedberg, I believe it was Jason. I think it was Friedberg who talked about the importance of labs in LA, in the Bay Area, and how they're being so expensive today because the life sciences labs, because there's a genomics revolution. So the investment that these companies do today or last year or 2 years ago, it will pay off eventually. But again, all depends on this program. There's so much visibility, guys. I wish I could tell you, I could literally make like 10 videos right now on the importance of CRISPR Therapeutics and Vertex program here. You can bet I'll be covering every single thing here, regardless of how the FDA approaches it. I really call out for all Americans to write to the local reps about Cures 2.0 Bill Act. And also, if you have any sort of means to get to the FDA about the visibility of this program, regardless of if you're supporting CRISPR-Cas9, I think there's so much at stake here. And I think if something goes wrong, it will set us back for years. And I don't think anybody wants that, especially not patients that are in dire need of these types of alternative treatments where you actually have a potential cure. So I'll end this video like this, guys. Thank you so much for watching. Do subscribe. Do like this video if you found value. And I'll see you guys in the next video. So hopefully you guys have a beautiful Sunday and a beautiful week. Thank you.